Hi, everyone. I'm Tonia Wellens. I'm the president and CEO of the Greater Washington Community Foundation. And today I am incredibly honored to welcome you to the 6th event in our series of social justice town hall meetings. This series is being presented by Wells Fargo. Their support allows us to create a space for community members to come together and learn more about important issues that are impacting our community, and to think about the concrete actions we can all take to build a more equitable region. Thank you, Wells Fargo. So the past several months have been incredibly tumultuous for our community and for our country. And while it has been incredibly challenging, it's also a reminder that there is still so much work to be done to ensure that our community is one where everyone has an equal opportunity to live, work, and thrive. Our community has faced a trifecta of crises, one that threatens our nation's public health, economic security, and racial justice and democracy. And while we know that the pandemic is new, racism and social injustices are not. The pandemic has served to further reveal many of the pre-existing inequities in our education system, in housing, healthcare, food security, policing and criminal justice, and income and employment. Earlier this summer, the Community Foundation released the results of our VoicesDMV Community Insights survey. It was conducted in early 2020 in partnership with Gallup. And our aim was to really better understand the issues and challenges facing our community and to hear directly from people in our region and their experiences in the region. We surveyed thousands of residents across DC, suburban Maryland, and Northern Virginia to really understand better the issues that mattered most. One of the issues highlighted was food insecurity. Before the pandemic, again, we knew that thousands of children, seniors on fixed incomes, and the working poor across our region found themselves unsure of where their next meal would come from. In fact, our VoicesDMV survey found that 1 in 10 Black residents in our region rated food availability where they lived as poor. Unfortunately, COVID-19 has exacerbated food insecurity across the region even further. In addition to those who struggled before, there are thousands more who were recently laid off, some of whom have had to tap into safety nets or don't know where to turn. And even if you've not personally experienced food insecurity, we know that it's important to focus on this issue because ultimately it impacts health, education, economic stability for the entire region. So where do we go from here? How do we ensure that everyone in our community can have access to food in order to thrive? We are excited to have experts with us here today to help us answer some of those questions and to share how we can all become part of the solution. So first, I'd like to introduce Dr. Tall Elliott, Chief Medical Officer at Mary Center. Over its 30-year history, Mary Center has grown into a regional community health center serving over 55,000 people with medical, dental, behavioral health, and social services. Dr. Elliott, please share with us your firsthand perspectives on why addressing food insecurity is so vital for the long-term health of your patients and our community as a whole.
Well, thank you for having me. Thank you for Mary Center for having me represent them. And I'm happy to be speaking with some very highly qualified individuals that will contribute vitally, much more beyond what I'm about to say. But I'm coming from the perspective of a chief medical officer of a health center. As you said, we serve 55,000 individuals. I am an OBGYN by training, and so I see it from the very beginning and to the very delivery and handoff to the pediatrician. In the seat that I sit in now, I see the global picture from the women that come to us, to the kids that come to us, to the parents, their grandparents, and beyond, even how it impacts on a subspecialty level. But, primarily I wanted to, at least answer some of the things that we already know. What is health equity? It means that everyone has a fair and just opportunity to be as healthy as possible. And unfortunately, there are barriers that need to be removed to make sure that we can promote that for everyone there. And there are some very real conversations that are going on right now, very difficult conversations based on the historical context of this country, that prevent us from really making sure that people can manifest their healthiest existence as a person. And so when you get into that, today we're here to talk about food security and how does that look and how does that impact? And there's a number of different variables that impact that overall. And so it's one thing to say, okay, I can't eat or I don't have food. It's another thing to dig down deeper into what's going on and why. And so I, as a physician, as well as the nurse practitioners, the midwives, and the other physician assistants, even the nursing staff and medical assistants, people at the front desk, still need to look at how does that impact the patient as opposed to what's going on here, why is it happening? So there's a variety of factors. There's the social context, there's the occupational struggle. I mean, how many jobs? My mother worked 3 jobs at one time, so how is her diet going to look? There's environmental changes, like can you grow the foods that you want to grow? I mean, in your neighborhood, can you get access to foods? There are health and there are food deserts that we're looking at on a regular basis, even in urban areas. And so that also impacts the patients that we serve. Traditional livelihoods, we're looking at intake of contaminants, what's happening to the food that they're eating. It's one thing to say, I have something on my plate. The question is it healthy? And so when we're looking at this and we're looking at the impact, how do I manage a child that's dealing with obesity? How do I manage a child that's dealing with asthma? How do I manage a woman that's dealing with gestational diabetes or an elderly person that has a lot of issues, nutritional issues in terms of the access to the foods that they need to eat to maintain a healthy lifestyle? And then you start getting into the dental component. What kind of foods do they have access to if they're edentulous and they have no teeth? And so it becomes a much, much more broader context when that happens. And so all of those things impact the person's health. You then start looking at the social determinants of health and how those things all come together as one. And so instead of us looking at it as an isolated picture of, okay, look, I really need you to follow your diet. You're not compliant. This is unacceptable. We really do need to start looking at the human and the person and say, what's the impact that's happening here? And then dig deeper. Now I can say, having an appointment scheduled every 15 minutes, really hard to go through that list. So I do rely on the staff, and our team does rely on each other to make sure, even if that day we can't get to that person, we still make sure we do an adequate assessment of their nutritional status. We have nutritionists at Mary Center as well to make sure that we refer them over as a warm handoff to try and ensure that they understand the impact it has on their overall health. And so there's a lot of little things at play here. And as I stated before, there's obstetrics, there's pediatrics, there's internal medicine, there's geriatric, even the subspecialties when you look at surgery. And so as a OBGYN, as a gynecologist, as a person who's done surgery, how are they going to recover from that surgery? How are they going to effectively heal from that surgery? Are they going to have an impact with a wound infection? And what happens if they go back to that hospital? And so you start looking at the bigger picture of what's happening. And I think that far too often systems look at a disease state by itself as opposed to looking at the person and the individual factor. And so when you take all those things into play, the one thing I forgot to mention, and I'm glad I wrote my notes because there's always so much, I forgot to mention the behavioral health component. If your child is acting a certain way, I have 5 kids, and sometimes I think, okay, either it's the gene that I gave them that's making them drive me crazy right now, or it's something that's in their diet. And so there's certainly, you can see how people behave and act differently based on the food and their intake. It's one thing to be ornery because you're hungry. It's another thing to see the behavior of a child be impacted based on the food that you give them and the access to resources that are available. And I bring this up lastly because it's incredibly important that we look at it. The impact to healthcare overall looks at a financial component too. There's finite resources that we have. We cannot just, say do this, do X, Y, and Z. But when you have a high rate of childhood obesity, there's a certain amount of money that has to go into that, and then that takes away from something else. It might take away from asthma treatment. And so we also need to look at the broader context of how, food equity, food insecurity, food security has a much larger role to play in terms of how we manage our patients. And so it's a deep hole, but it's something that's necessary. And lastly, I think that one of the things that is beginning to be recognized are the role of the nutritionist. Unfortunately, the payers don't pay for that. There's a limited amount of money that they'll pay for. So if you're in Maryland and on Maryland Medicaid, they'll pay for if you're on dialysis, if you're a diabetic. That's it. And so they don't understand. It's almost as if they say an ounce of prevention is worth a pound of cure. It is extremely important if we start looking at how nutrition plays a role in overall health. So they don't get to a person like me having to send somebody to an oncologist, or me having to send somebody to an endocrinologist, or an orthopedic surgeon or podiatrist who has to remove a toe because their diabetes was not under control, or to an ophthalmologist because they're going blind because of their diabetes. And so there's a large number of factors that are at play here with respect to food security.
Thank you, Dr. Elliott. Nice way to kick this conversation off. And I just appreciate how the conversations about food are just so much more expansive now. Radha and I were in a conversation last week around food as medicine. We're really just thinking about it not just from from a survival perspective, but really from a healing perspective. And I just really appreciate that opening. This now leads me to the wonderful introduction to the President and CEO of the Capital Area Food Bank, Radha Muthiah. For 40 years now, the Capital Area Food Bank has been addressing hunger in the Greater Washington region. Before the pandemic, the Capital Area Food Bank provided over 30 million meals to neighbors in our region, and we are incredibly proud of the work that they've been doing in response to COVID-19. And so it is my pleasure to introduce Radha Muthiah.
Great, thanks, Tonya, and such a pleasure to follow Dr. Elliott. You raised just so many issues, and which are also critically important as we look at that continuum. And I'm so glad that you're an OBGYN and could start from birth and go all the way through the continuum of life, because food has an important role to play, good nutritious food at each of the stages of our lives, and can contribute, as Tonya just said, to so many other end goals, whether it's education, healthcare, more inclusive economic growth, etc. So I'll just I'll frame the issue slightly differently, building upon what you've done, from looking at it as a social justice issue. Food is absolutely a social justice issue. Access to it, enough of it, and being able to, afford it. All of those are important social justice issues.
So, can you turn your microphone up just a tad bit? Is that possible?
Sure. Is this any better?
Yeah, that's a bit better.
Okay. All right, great. So we live in a region, as we all know, the Greater Washington region, that's incredibly wealthy on the one hand and incredibly needy on the other hand. So it is a region with tremendous inequities. And, I wish I could say, oh, the inequities only lie in certain wards or in certain counties, but actually I can't say that, because they lie across the board in all of the counties and wards in the regions. So it's one that we have to really have to address, because there are significant disparities. Whether you look at it from a health perspective in terms of lifespan of individuals, and I know some of you have heard me say this before, there's a 30-year difference in lifespan for someone born into Ward 8 versus someone born into the Chevy Chase area in Friendship Heights. Yes, there are many factors that lead to that difference in lifespan, but a big one and a big driver is just the access that they have to good quality food that promotes a healthy lifestyle and lifespan as well. We're seeing other differences in terms of just unemployment. If you look across people of color and those who are white, you see 3, 4, 5 times the differences in unemployment rate. When you look at education, you see huge differences of those in the wealthier parts of our region versus others. So I don't think I need to convince anyone, but just to sort of set the stage in terms of the inequities that exist and the role that food can play here in terms of trying to reverse these inequities and accelerate progress on a number of fronts. Tonya said earlier, in our region, we have about 400,000 food insecure individuals prior to COVID and prior to the pandemic. That number, unfortunately, is more like 600,000 individuals at this point. So just in the last 6 months or so, we've seen a 50% growth in the number of food insecure individuals. A portion of these are individuals who, were partially food insecure before, and now are sort of more fully, if you will, food insecure in terms of their dependency on others for food. And many of them are newly food insecure individuals. Many who were living paycheck to paycheck, could make ends meet. Dr. Elliott, you talked about your mom having, 3 different jobs. Many of the clients that we serve have multiple different jobs. They're not just sort of sitting back and waiting for support, but 2 of the 3 of those jobs in many cases no longer exist for them. And so they need this additional support from food banks and others. Our region is also seeing the 5th highest rate of growth in food insecurity compared to the other regions within the United States. So there are 200 food banks across the country. Each of us has our own unique service areas. So as we compare service areas, this greater Washington region is number 5 in terms of the growth rate of food insecurity as a result of the pandemic and the economic downturn. So while we're insulated in so many ways because of the federal government, et cetera, we're not insulated when it comes to those who are really feeling the effects of COVID and the economic downturn. The other thing I'd say from a hunger report that we released a few months ago, which is where many of these stats come from, and I would urge you all to look at that. It's on our website, for a little bit more information. The other thing that I think was surprising and will be surprising to many is that these growth rates that are occurring in food insecurity are not just occurring in sort of typical places that you would expect, in Ward 7 and 8, in Prince George's County, in the Route 1 corridor. Yes, they are occurring there, but the highest growth rates are actually occurring in Fairfax County and Montgomery County. And so the counties we wouldn't automatically think of as having the highest rates of growth with food insecurity. But it just shows you also where unemployment is, and where that is translating to poverty and food insecurity as well. So as a food bank and as a network, we operate through 450 plus partners in the region to help deliver food to those who are in need. And I'm so pleased to say we partner with everybody who is on the panel here today, because it does take all of us and various kinds of partnerships to be able to get the food out to those most in need. But our entire distribution network has changed completely. And so we're bringing in new types of partners who weren't food distribution partners before. And, we're actually excited about some of that because our new partners bring in other types of services, which we know that, our clients who are food insecure are in need of as well. So Mary Center, a relatively new partner in the last few months, really exciting partnership there, that is not just about getting food to those who need it, but bundling food with healthcare. And so, having a food pharmacy on site to be able to address some of the things that Dr. Elliott just spoke to earlier, recommendations on what people should be eating given conditions that they have, knowing that, an ounce of prevention, is worth more than a pound of cure, et cetera, as you said. So there's a lot more there that in partnerships like that we're trying to put into effect. One thing that has changed dramatically is that we're really not getting food donations to the level that we used to before. And so 60% of our food supply used to come from food donations. That's dropped by about 70%. And so we're just purchasing almost all of the food that we're distributing now. For us, these are shocking statistics as we go from providing 30 million meals to 50 million meals this year in our community. We are now purchasing 6 times the amount of food that we have before. So our budget used to be $3.5 million thereabouts for purchase of food. We just did our reforecast yesterday. It's north of 20 million for this coming year for the purchase of food. We're just not getting the donations. The numbers are going up to 600,000, who are in need, and they are in need for many more days a month of food from the food banks, especially given that we don't have a stimulus bill, that has currently been passed. So those $600 in extra unemployment insurance, the $1,200 or $1,500 stimulus check that people got during the summer, none of that is accruing to them and has been accruing to them since August. And so this is a challenge that we are seeing, and we know, and we're worried that we won't see another bill or legislation rather till after the election. And so that's, for some people would look at that and say, well, that's just a few months. Well, that's a few months of 600,000 people not having access to a few $100s more to be able to spend on food. And that's substantial. So I'll just conclude this section by just saying there's some very good public-private partnerships. I mentioned one with Mary Center. I'm sure we'll speak to one that, we engaged with in Montgomery County as well. It will take government, it will take private sector, it will take nonprofits working together to be able to meet these needs. And so lots of creativity, which is fantastic, and look forward to taking your questions as we go forward. Thank you.
Perfect, Radha. You're absolutely right. It will take all of us to respond, particularly given some of the, the facts you laid out about some of the shifts that are more recent to members in our community, not receiving new stimulus resources, ending of the pandemic unemployment, and the, the challenges that winter months bring with them, with, food and housing insecurity, et cetera. So I'm happy now to turn the conversation to Chris Bradshaw. Chris Bradshaw is from Dreaming Out Loud. They are a partner with us for our COVID-19 response work. And we really appreciate the work, the approach that Dreaming Out Loud takes to both addressing food security and building economic opportunities for Black and Brown communities. Chris, why don't you tell a bit about Dreaming Out Loud and offer your perspective as well.
Yeah, absolutely. Thank you so much for having me and for all those who are joining us via streaming. Dreaming Out Loud's mission is to create economic opportunity within marginalized communities by building a healthy, equitable food system. We operate a 2-acre farm and food hub in Ward 7, situated behind Kelly Miller Middle School in Lincoln Heights, which is one of the largest public housing communities in the district. In our work, part of our mission is that economic aspect of the food system. Our previous speakers have touched on the fact that we are not only dealing with the current pandemic of COVID-19, but the 400-year-long pandemic of white supremacy. And for us, in our analysis, that includes an economic reckoning, an economic viewpoint, and framed by the racial wealth gap. And so that's a theme that we see consistently throughout our work in terms of who is impacted and who is able to survive literally, physically, and also economically through the COVID-19 pandemic. Those circumstances being shaped by a history of chattel slavery, racial terror through the Jim Crow era, redlining, and other policies that have denied wealth generation and wealth accumulation to generations of Black families. And we see that impact across the board. The Urban Institute had a study just a few years ago that said that in the district, white wealth is 81 times that of Black wealth. And we can see that in times like this, where unemployment spikes in the communities where we work, you have one out of 2 adults who do not have employment. And so in those instances, folks who lose income, if you have wealth, you have something to fall back on. And we've seen that wealth being the safety net for folks, and our folks do not have a safety net. And so in our response, we have worked to meet folks where they're at, deeply situated within communities. Over the course of the pandemic, we were able to partner with other organizations like World Central Kitchen, DC Central Kitchen, Capital Area Food Bank, and even restaurant partners like Little Sesame to help coordinate meals, emergency meal production, and get them to our community-based partners that we've spent years building relationships with. We coordinated over 250,000 meals, of which more than 45,000 were produced by Dreaming Out Loud's alumni from our food entrepreneurship program called the DREAM program. And through that relationship with World Central Kitchen, we were able to actually contract for that meal production to support 4 Black woman-owned businesses who were then able to generate more than $350,000 in revenue between April and August of this year, supporting 15 Black workers. And so when we're talking about the work that we do, when we see a challenge, we want to find ways that we can utilize and empower community members to benefit as agents of change, as economic beneficiaries, and not just recipients of aid. And so that's the framing of our work. We have also been able to, over the course of the pandemic, scale up our ability to distribute produce. As an organization that is both a farm and connected to other farmers, particularly Black and other BIPOC farmers. We launched on Juneteenth the Black Farm CSA, and in partnership with DC Health and DC Greens, we were able to distribute about 1,300 shares of that community-supported agriculture program per week. So essentially, that's a grocery subscription that folks were able to receive weekly. We have some members that pay market rate, but we also have free shares for those who are unable to afford it, for anyone that's receiving SNAP, Medicaid, Medicare, and those type of benefits. And so we're also able to drive revenue into the bank accounts of Black farms. But as we talk about this type of work, you know, we love to tell stories about who's being impacted and why. You know, when we were out front of Kelly Miller Middle School giving away free meals, we have had folks come up to us and tell their story. You know, I had a woman come up to me and say, I have only $14 in my bank account and my father just passed away. If this was not here, I don't know how that I would eat. And she was there with her son. So being a frontline worker, we see the impact day to day. You know, she did not have family wealth to fall back on in the event that she lost her job and lost her income. And so this is what our communities are facing. And so at present, we're working to bridge those gaps in food security, but find ways to facilitate economic opportunity for food makers, farmers, as well as community-based hiring. We were able to, with these opportunities, scale up our own organizations, operations, and hire folks from within impacted communities to create employment. And while these are all worthwhile efforts, we know that this is just a drop in the bucket in terms of what we're facing. And so, you know, our solutions going forward must include, you know, cross-sector partnerships. It includes the government. You know, we just mentioned that we've been waiting on a stimulus package that is fit for the circumstances, and that seems that it may not come anytime soon, and soon meaning immediately, because that's how urgent the circumstances are. And so I think it is gonna take all the creativity and innovation and resources of the private sector and local authorities to step in and bridge some of these gaps in ways that can support community members at this time. Thinking about also, you know, what an equitable recovery looks like. First, it's recognition that circumstances were not equal to begin with. And when I think about ways in which we can be more radical and be more aggressive in terms of what comes next, I think about one of our community meal sites, Garfield Terrace, which is a senior public housing community located in the Northwest, just a few blocks from Howard University. And I think about the activism of one of our, you know, long-term partners, Bo Musin Umar, who is the president of the Garfield Resident Council, and his efforts to turn that complex into cooperative housing. You know, so when we're talking about generational wealth and the things that were structurally denied to Black folks prior to, in these moments where we're discussing, you know, I would say looming eviction crisis, but the present eviction crisis that we're in the midst of, and we're talking about how do we build out structural solutions that can both support communities now, but work to repair previous harms. We need more solutions like that, you know, helping communities like Garfield Terrace become resident owned. You know, it overlooks a new Whole Foods and several new condos where white wealth purchased those condos and will drive that revenue into the Whole Foods. And that was someone's plan. And so for us, it's about building power and bringing voices to the table that can work to bring people into solutions that actually get at the root causes. And so for us, it's open discussions about reparations and pushing the powers that be to make concessions to the community in the same ways that they make concessions to money interests across the city.
Thank you, Christopher. Nice historical perspective on what got us here, and some great forward-looking thinking about what it will take to undo all the damage and harm that has been done. And hopefully we'll get to discuss that a bit more in the Q&A. So now I'd like to turn it over to our final presenter for the afternoon, Councilmember Will Jawando. He is a key partner and a key champion for many issues, but especially for food in Montgomery County. And so we are very pleased to have a new partnership that's recently emerged in Montgomery County with Councilmember Will Jawando. I'll just turn it over to you.
Thank you, Tonya, and thank you to all of my fellow guests. This is an all-star panel here, and it's good to see everybody. You've really set the stage well. I just wanted to add a couple of really staggering statistics and then get into why this is so important. And I'm so glad that everyone joined today. We are in uncharted territory here, in our lifetime, as has been mentioned. And a couple things particularly, and I think Radha emphasized this, that, you would think in Montgomery County, obviously we're here to talk about the region, but in Montgomery County's Food for Montgomery effort, that we would be doing better off. And this is really harming big metropolitan areas and those who are working in the service industries, particularly hard, and women and people of color, and particularly Black people. If you look at just how unequal this, many things have been written. There was an article, I think, in the Post a week and a half ago about how this is the most unequal recovery we've ever seen. Of the 1.1 million, people who stopped working and looking for work, labor rate participation last month in September, 80% were women. 80%. These are women who obviously have made the difficult and untenable and unfathomable decision to stay home and try to navigate a very chaotic and difficult virtual learning environment, but at the expense of either their job or their job search. And that has direct implications on many things, rent and utilities, but also the ability to provide food for their families. If you look at who's gotten their job back since we were in the middle of the worst parts of the coronavirus and everything being shut down and layoffs happening, mass layoffs back in the spring, African Americans have fared the worst. Barely a third of them have retained employment as of last month of the people who lost their job. That number is bad for everybody, but to just give you context, 60% of white Americans have found work or entered labor market again. And it's a little slightly above African Americans for Latinos, but not much better. And so we have significant challenges and signals and points that economists show us that this is a long road and that certain communities are going to be hit very, very, very hard. And we're seeing that here in Montgomery County. Last spring we had almost 90,000 residents file for unemployment, which is very high for us. And we have 1.1 million residents here in the county. We watched weekly demand for food go up more than 500% here in the county, roughly 350,000 pounds of food each week. Right now, 100,000 of our county residents, 1 in 10 of our residents are struggling to put food on their table right now. This is in Montgomery County. Let me remind you, the wealthiest county and the wealthiest state, depending on the year, we bounce back and forth per capita. And we have more millionaires per capita in Maryland than any other state normally. In the wealthiest country in the history of the globe, 1 in 10, the people in that county are struggling to eat every day. In addition to all the children and the seniors and the working poor who were struggling before the pandemic, as was mentioned, thousands of first-time people in places that you wouldn't expect, like our county. I'm really happy that we've seen an outpouring of response. It was mentioned, my church, the Kingdom Fellowship AME Church, and so many others, but they created a food ministry to bring relief to people, never had been in the food business, in the food either purchasing or passing out. And they started from scratch and in ways that were very cute, as you would say, Radha would say in her business. They started going to Costco and Giant and purchasing things, retail, with their own money. No one asked them to do it. They saw the need, and this is the story of so many people, and stepped up and started passing it out. And so while I was volunteering, I said, well, all these groups are doing these little disparate programs and are applying the same approach, not necessarily leveraging and using their resources in the same way. They're doing gas to and from, they're going to purchasing things for more expensive than they need to be. And so we could really be feeding more people in a more coordinated way. So I was glad to connect Kingdom with Capillary Food Bank, and I'm really thankful to Radha and their team. They're one of the many new partners that has come in this space with new energy, with investment, with volunteers. And now they're feeding thousands of people a week across the eastern part of Montgomery County and into Prince George's County. And they're just one example of how we have stepped up and how people have been innovative in this time. In my role on the county council, I saw that we needed to do more. And we've invested millions of dollars in this effort and will invest much more, but also said, how do we catalyze our community, the whole community, government, business, nonprofit, the faith community, and our residents, our philanthropic community, to get them to come in and say, we are not going to let our residents, our families, our neighbors go hungry at this time. And I'm so proud that the Community Foundation, that we were able to partner with them to set up this Food for Montgomery and launch it over the summer, which is a coordinated public-private partnership to respond to this disturbing spike in food need as we've been talking about. The initiative has 3 goals. 1, meet the urgent need our residents have right now for food. Tonight, this is not an abstract thing. There are people who need food right now, and that will, thank God for this initiative. We've set up a program in the county through our hubs and through the support of this initiative, where we have food distributions at apartment sites, at hubs, at different parts of the counties, 6 days of the week. They're placed here in Montgomery County. We have food distribution and other delivery services going on, but we need to maintain it and we need to grow a stronger system. So that's number 1. We need to meet that urgent need, and that's what we're doing right now. But it's going to be an ongoing effort. 2, we're supporting our farmers. We have a big agricultural reserve here, and we have a farm to table and table crops program. They are struggling, so we want to sustain and help them and strengthen that connection, our food security. And then we want to help our small businesses, our restaurants, who have been hit hard, many of whom have had to lay off the people employed that need the food assistance, and which is just one of these horrible things that's happening. And we want to, so they can help, they're helping us prepare prepared meals that deliver to seniors, people who can't get out, and supporting our local economy at the same time. And then all of this is for our 3rd goal, to strengthen our food system, our hunger relief system in this area, so that in this region, so that we come out stronger and more coordinated going forward, and we're prepared for any future challenges, and we build that resiliency. So this is a coordinated effort using a combination of federal CARES Act dollars, county dollars, and again, the private sector. And we need your help in this effort. We're off to a great start, thanks to the Community Foundation and some great partners like Washington Gas, David and Michael Blair, the Kaiser Permanente, IKEA, Roberts Oxygen, and obviously folks like Capillary Food Bank. What's unique about this is that it's got everyone you would want to see partnering for the benefit of our community. Our Office of Emergency Management, Health and Human Services, the Montgomery County Council, the Food Council that we have, the Community Foundation, food banks. This is what we need, and this is the effort that we're embarking upon today to do it strategically. We have a great plan that you'll hear more about. So we've realized we needed to expand this capacity so providers can get more food to more people in a more effective way. That's what this is about. We've made over $1 million in grants to local organizations, some of which I mentioned earlier, who are stepping up to get food to folks and support those needs right now. An example, that some of this has gone to purchase refrigerated food trucks, right? So that food can get to a place and not spoil, and can be delivered to apartment complexes in our East County and other parts of our county. These investments in the summer are going to help our capacity going forward, but we still know that the fall and the winter are going to be tough. So we're going to need more help there. As I mentioned, our small farms are very vital. And the last thing I'll say about that, they need our support as well to build a stronger food system. And then wrapping all this up, we're collecting data so that we know how to do this better, and we know where people are, and we're mapping against other needs. So not by contributing and participating in this, you're going to help support needs of other residents, things like rental assistance. We've been doing census outreach, a whole range of needs that are coming out of this initiative. So I just thank the Community Foundation. I thank my partners, and we want to make sure that no one goes hungry here in Montgomery County or in our region, and that's what Food for Montgomery is about. So thank you, Tanya. Thank you, everybody.
Thank you very much, Councilmember Jawando. Thanks for all that you do. Really appreciate your work. So a lot of important things continue to emerge in this conversation. One of the planned questions was, what's keeping you up at night? I think you all have already told us that. I want to see if we can probe a little bit into, how we can hold what might appear to be competing priorities at the same time. You know, one, we know that we're in a state of emergency. You know, how do we hold the survival needs for food alongside the notion around sort of health equity and food as medicine notion, and then this notion, Chris, which I think you introduced very nicely around sort of the food as a driver for economic justice. Both you and Councilmember Jawando note those. But how can we hold all of these things at the same time, and how should we think about them as we're planning and looking toward the future? So we could just spend a couple minutes there, and then I'll go to the chat to read out some of the questions there. Who wants to jump in on that?
I'm happy to jump in, Tanya. You can hear me, right?
Yes.
Okay, great. I think, you know, you're right. On the one hand, they do seem like competing priorities, but I would argue that they actually aren't. Because, you know, if we're providing food that is nutritious to begin with, whether it's food that's free or closer access to nutritious food, you're already addressing the health issues that are related to that. So, you know, the classic example is, you know, don't hand out donuts and pies and sheet cakes, you know, things like that, just to provide empty calories, you know, to address someone's need today, you know, because they're hungry. And I think so many in this area, and I know speaking on behalf of our network, I mean, 80% of the food we provide into that network is low sodium, low sugar, high fiber. 40% of it is fresh produce. So let's start, we're there, let's continue, you know, and let's, if anything, increase that. That's the initial pipeline, if you will, of food that's going out into the community. So that will address both hunger today, but also healthy outcomes as a result of better food. I think the combining that with nutritional assistance, I think Dr. Elliott brought that up earlier. We do that at the food bank. I think Chris does that as well, you know, and so many of our partners do that. That, you know, the behavioral change and the knowledge and understanding of why one should eat better and how you can eat better on a budget, all of these things are so critical to support healthier outcomes. And when you have good food, healthy outcomes, and access, you then have a population that is healthier and can be more productive, you know, and engage in the workforce. So I would just sum it up by saying it is a continuum, but you have to start with good, healthy food to begin with. And then you have the ripple effect that will come about with, you know, the ability to engage in the economy, you know, because you're healthier and you're not, you know, having to deal with various diseases, et cetera.
Great, thank you. Christopher?
Yes, you know, I couldn't help but recognize one of these bitter ironies over the course of the pandemic when we were distributing these incredibly delicious and healthy meals in the communities where we work. The irony being that this is the best food that has ever been available, and it took a crisis to make that happen. You know, you had folks who never had Israeli couscous before, you know, coming back and saying, this is amazing. Why can't this be in my neighborhood? And so for us, it was also gratifying in a sense when we were able to have food provided by folks that look like the community and to, again, fulfill that healthy, nutritious, and delicious requirement as not just a health requirement, but as an act of service and an act of love in this moment. I think that, again, highlights the ways in which we can, again, use one problem against the other one.
Right.
And we have to continue to think about ways that we can do that. You know, how do we get these folks back to work that have these incredible skills? But again, it takes the resources. I see one of the questions that someone posed was, you know, how do you continue to fund these efforts? And I think that it's going to take a lot of creativity, tapping into available resources to make things happen. You know, there's been instances in the district where some of the agencies have returned resources to the federal government, leaving them unspent. I think it's time to look at these various pots of resources, maybe workforce development dollars and other resources that can be rethought and reapplied to these new circumstances that could give folks a lifeline to new skills on the other side of the pandemic. So I think we have to take this crisis as an opportunity and look at every available resource that we can utilize to stabilize communities and build what comes next with a just framework for that.
Thank you. Dr. Elliott, I want to invite you into the conversation. Oh, sorry, Will, you want to get in? Come on.
Go ahead, Dr. Elliott. Go ahead, Dr. Elliott. Go ahead.
Will, I'll follow up after you, please.
No, I just I think it's such an important point that was made. You know, if you think about, you know, as an elected official, right? When those of us who are in the, and I'm hearing some echo from somebody. I don't know if it's you, Tonya. There you go. What are the basic human needs? Like when you get into wanting to help people, like food is like the first thing you say. You know, food, water, shelter. You know, you think about what is the role of government? What's the role of a just society, the social contract we build? What should people have a right to and not be in lack of, so that they can be productive members of society? As I think Radha was mentioning, it's usually the first thing, right? It's usually like the first thing that's said. And I think, so you can't disconnect that. You can't, it's not a competing priority. It's a baseline. It's something that should and always should have been and should be something that people have access to. We know they don't and haven't, and this has made it worse, which is why I think one of the great goals of this effort is to draw that connection even and closer and deeper, and make that connective tissue more apparent, because, you know, we are losing out. Not only is it individually bad for these residents, and is there an economic case to be made that when there's not access to this type of food, we're paying for it. Lord knows we're paying for it in healthcare costs. We're paying for it in lack of productivity and economic issues. So however you want to approach it, it's bad for us as a society, and it's something that will improve outcomes and actually lead to higher productivity and savings if that's your angle. But it's also the right thing to do, and it's a basic human need, and we must do it. And so I think we shouldn't separate it at all. And I think this pandemic has showed us that you can't, and that it's intertwined.
Thank you. Dr. Elliott?
I mean, I think for me, everything goes out the window when somebody is concerned about food. I can't talk to them about all the other issues that I would like to talk to that day. I can't address that. I mean, a child can function in school. A mother can function and focus on the baby. A father feels stressed out, when you're there to talk about their cholesterol. And so those things kind of, it is a continuum, but it is absolutely paramount that this is something that is, as was stated earlier, with like a food prescription, or you prescribing it like a food pharmacy. This is something that is absolutely imperative to us having good health outcomes. We can't enter into these value-based purchase agreements or incentive plans to help encourage providers to do better in terms of the health that they provide if we're not actually making sure that we do everything within our power to make sure that that person can thrive. And that's what comes in.
Dr. Elliott, while we have you, would you mind sharing a bit about two things? One, and we'll do this in round robin style, partnerships and fundraising. What's the outlook?
The partnerships are there. I mean, there's a ton of ideas. I mean, anytime there is a stress on the system, that's where the innovation starts to come about. Even more so now. We've talked about giving people prescriptions for farmers markets. We've talked about a lot of different things there. And I think that as long as people are willing to be vulnerable to their blind spots, that's when the new partnerships start to develop. I think it's when you get so structured in those ways, that's when you start to not see, Christopher. That's when you start to not embrace Radha. That's when you start to not see Councilmember Jawando. I mean, you really need to be more broad in your thinking and think almost like a child to say, what can we do? Where can we work? And so I think it's when we get too structured in our thought and when we're too quick to say, it's just too hard. That's not an acceptable solution. We definitely need to think more so outside of the box.
Absolutely. Christopher, partnerships, fundraising.
Right. The partnerships are emerging. I think they're, our work is fundamentally built on partnerships, both with community, other organizations, district agencies, and faith-based institutions across the board. And so just to highlight a little bit of how our partnerships work, I'll give the example of Pinky's Eats, which is one of the producers that helped to make emergency meals in the prior months. Pinky is located within Metropolitan AME Church on 15th Street, downtown DC. She's an innovator. She's been able to turn that space, that kitchen space there, into shared commercial kitchen space. And so she's able to produce emergency meals there. And she was one of the producers that was able to generate revenue and keep her employees on staff. Those sets of resources came from, at that time, World Central Kitchen, Dreaming Out Loud. As we have been moving forward, we've been able to partner with other private sector organizations to provide resources, from everyone from Sweet Green to Tito's Handmade Vodka, surprisingly, stepped up and helped us continue part of our CSA shares going to the community. And now, as we're moving into a different phase with this more extended relief effort, we're working with DC Central Kitchen, World Central Kitchen, and engaging other private sector funders, but also the government, to be able to hopefully move forward with a proposal to be able to produce more meals, to be able to drive those resources again down into the grassroots, deep within the community, those makers and those farmers, so that we can continue to see some sort of economic activity generated within the most impacted folks. And so, partnerships have to function on a lot of different levels. There's always going to be, new logistics to figure out, infrastructure to figure out, the particular dynamics of a community to understand, and in order to deploy the resources in a way that is respectful of the community and impactful to the community. So, I think there's a myriad of ways in which the, partnerships are unfolding, but I think that they're there. But the resource question is one that we all will see and all will face, particularly when you start to get into the colder months and we have folks that aren't coming outside as much. We continue to, get calls about shut-in seniors who need food, things like that. We're going to have to be really creative in the ways in which we engage, continue to engage folks like the mutual aid networks to be able to reach people where they're at.
Thank you, Christopher. Radha, and then Councilmember Jawando will give you the last word as we're wrapping up. There's not enough time for us to have this conversation, but we're bound by the clock. So Radha, over to you.
Sure, I'll try and complete my remarks in a minute or so. I think in terms of partnerships, yes, I mean, I agree with everything Chris said. I would just highlight a few interesting ones that we're in the middle of right now. So when it comes to workforce development, because I saw a question there on that, we are working with community colleges for certification programs where people are dropping out because they can't continue. They need to hold a job instead of continuing in that program. And so we are providing free groceries for them and their family as long as they stay in the programs. And then we've connected them with employers who are guaranteeing sort of, certain 100 jobs that they will hire people for once they've completed that certification. So that's an interesting partnership with community colleges, us as a food bank, and employers. So that's one on the workforce side, and where food can play a critical role in keeping people in those programs. Another one is on healthcare. We've got insurance providers who are now looking at the fact that they should support the preventive part, the healthcare part, not just the medical part, so that they don't have these huge claims, on the back end. So we've got several pilots in food pharmacies to see whether better nutrition upfront, supported by insurance companies, can reduce claims and reduce incidences of disease on the back end. So this is food as medicine for healthier outcomes. In terms of the resource question, I think for the donors on the call, you have to think about it in two different ways. One is there's an immediate need for response today because there are people, 600,000 to be precise, in our region who are hungry. They are going to be hungry for at least a year, if not longer. They are at the bottom part of the economic recovery curve. Most people are thinking about the top part of that curve. So this will take a while. And we need resources. We're buying the food to be able to provide them. It's as simple as that. The second part is to think about how we engage them very thoughtfully, but in an accelerated manner in this recovery, so that they are part of it, and they don't want to be dependent. Not a single one does. They want to be supporting their own families, but they need to have a role in this economic growth. And there are various approaches that we and other nonprofits are taking to make sure they have a place in that growth. So if you're a donor, please support the current response, but also think about how you can support all of us from a recovery perspective so that we do achieve something that's more sustainable.
Thanks, Radha. Will?
I couldn't agree more with all of my very talented co-speakers today. You know, nothing is done without partnership, right? And partnership can be catalytic for systemic change. And I think we're seeing that happen in various forms of innovation. I'll get, the example I mentioned earlier, I'll just expand on it. You had Kingdom Fellowship AME Church, never giving food before, large church, wanted to help, connects with Capital Area Food Bank, starts out as a mini, kind of, I forget what the word is, but, area hub or, distributor, and then connects with the county government in 2 counties that it's right near, and is now a regional hub for all sorts of services in that part of our state, where you're getting connection to workforce development, where you're having COVID testing occur in their building that's closed, but it's big enough to space out and get people tested and get people health care. You're getting casework management happening. You're getting temporary rent assistance programs being, I mentioned the census outreach. And so you're having something that wasn't there before, where there was need before, now being addressed holistically, and people getting access, and helping us, those of us in government and in nonprofit, have access and reach into the community that might not have been there. And I think you heard a lot of other examples of partnership. I think that's just scratching the surface. I think there's so much we can do to be more innovative and to leverage this for a stronger system coming out of this. And to Radha's point, for the recovery that has been horribly unequal, as I mentioned earlier.
Thank you all very much. I really appreciate the work that you do every single day, first and foremost, but also for spending your time with us for this panel. Certainly not enough time given all of the depth that you all bring to this conversation, but I certainly appreciate it. Partnership is the sort of the theme for 2020, and if there is a silver lining at all about this pandemic, it really has been how the community has stepped up and how we've figured out how to do things differently and to do them together. My hope, and I'm trying to position it as hope and not fear, is that we can sustain the ability to work together for the long haul, because the moment we return to our silos is the moment we return to sort of the business as usual. And we know if we turn to business as usual, then the people who have been disproportionately impacted for so many years will continue to be disproportionately impacted. And so it is, I think, all of our calling, and even at the Community Foundation, we're saying every day, how can we be a good partner? But we have to continue to ask ourselves, how can we be a good partner? How can we continue to push and innovate and drive toward sustainable solutions for ourselves and our community? So thank you all again. Thanks for all of you who attended with us and allowed us to run over time. Really appreciate it. Our next and final social justice town hall in the series will happen on October 29th at noon, and we'll be talking about how we can ensure equity for small businesses and entrepreneurs, actually building upon the conversation that we've begun today. Again, thank you all very much, and enjoy the rest of your week. Take care. All the best.